It's Nate with Pulse PEMF and the Pulsecast here at the 2025 Biohacking Conference. We're having real talk about real tech that's leading to real transformation. So, of course, we had to have Panos from PNOE, a groundbreaking approach to breath analysis. Panos, thank you so much for joining on the Pulsecast.
Hey, thank you so much for having me. Excited to be
Absolutely.
here.
I'm glad. How's
Yeah.
how's the conference been so far?
Oh, it's our first time attending the Biohacking conference, and it's been, we're very pleasantly surprised. It's a great conference. I think a lot of people interested in breath analysis, and we're also very excited to see that there's a decent amount of providers.
Yes.
We sell to providers, so that's our primary focus, right? And yeah, it's been great.
Isn't it awesome that this community you don't have to sell to? They already get it. When you say
Oh yeah,
breath
yeah,
analysis, they're like,
yeah,
all right,
yeah.
I understand.
Yeah, and I think still breath analysis is not something that people are like, tremendously aware of, right? So there's still a lot of ground to be gained in terms of
Yes.
awareness.
Yes.
But I think that what makes this crowd very interesting is that they're very open to new things, right?
Yes,
And so
absolutely.
even if they're not aware of something, they're very open to discovering it.
That leads me to a statement on the PNOE website that I thought was so bold and so profound. It's a simple sentence, but it really caused me to ask the question then. The sentence was, breath contains the most complete picture of your client's body.
Yeah.
Now, I think most people are used to blood tests and wearable devices that measure biomarkers, but breath analysis may be new, like you said, to a lot of people. Thankfully, this community is very open minded. I think all those watching the Pulsecast are going to be very open minded. Can you explain why breath analysis is so important?
Sure, absolutely. So breath analysis is not something new, right? It's been
Hmm.
around for about 100 years. In many cases, it predates like most of the traditional biometric testing that people do. And it is a very functional assessment in the sense that it looks into the functional component of certain elements of your biology. And these elements are, frankly, what is keeping you alive at any given point in time. So if we double click on what is happening when you're doing breath analysis, which is in medical nomenclature, cardiometabolic testing
Hmm.
or cardiopulmonary exercise testing. That is
Yeah.
the terminology that is being used in the clinical world. What you're basically measuring is how much oxygen your body is consuming and how much CO2 it's producing. And by doing so, you're effectively analyzing the combined operation of all the different systems that are participating in oxygen delivery and carbon dioxide clearance. And if you think about it, these systems would be your lungs,
Hmm.
your heart, your blood circulation, your cells, and then your nervous system. So, by collectively analyzing 23 biomarkers that we pick up from the device, we can understand how these systems are operating in unison, but then also how each individual system is operating.
Okay.
And this is what makes breath analysis arguably one of the most fundamental assessments about human biology and really the only comprehensive functional assessment. Um, a metric that is gaining a lot of popularity these days is view to max.
Yep.
And if you think about this oxygen chain, that's how we like to describe it, which is your heart, your lungs, and your cells, right? This, trifecta of systems that is pushing oxygen in and clearing carbon dioxide. If you think about it as a unified system, view to max would be sort of the global KPI.
Yep.
So if this chain is working well, you have a high view to max. If one or more parts of that chain starts to break down and starts to be deficient in some capacity, then that's going to throttle the amount of oxygen you can channel
That makes sense.
downstream.
Yep.
And as a result, that's going to bring down the total maximum amount of oxygen your body can push in. And that is reflected in a reduction in view to max. And that is, why ultimately view to max is such a great indicator for longevity and your risk over mortality and morbidity and all these things that have been established now by the American Heart Association and multiple other like highly esteemed medical organizations. It's basically the global KPI of all the systems keeping you alive at any given point in time, and also the systems from which most chronic conditions will likely emerge.
Yes.
It's interesting to think about the fact that most people will either die of heart attacks or heart disease, something related to their lungs or something related to their cells. And so it is uh, very interesting to understand that and realize that most of these conditions are ultimately reflected in some way through a disruption in oxygen delivery from the respective system. So when you have, for instance, like heart disease, then if you look at some of the cardiometabolic variables that you can pick up from breath analysis, you're going to see that the metrics that correspond to the oxygen delivery capability of the heart have gone down, for
Okay.
instance. And so uh, that's why uh, breath analysis is not just an assessment for your, overall vitality through VO2 max. It's also a very powerful tool to understand the underlying limiting factor. So out of the three systems, right, which one is deficient, and therefore where do I need to focus my attention in terms of training, in terms of nutrition, in terms of biooptimization services, right, in order to improve that specific system.
So you said that you go to providers. This is
Yeah.
not a direct to consumer
Mhm.
type of product. So what kind of training do you provide for those providers
Mhm.
so that they know how to take the next step?
Sure. Great question. And, it goes back to how we evolved as a company. So, um, the whole idea started from my co-founder, who was basically doing his PhD in sensing technologies. And as part of that, he got interested in breath analysis because, as, we've established, like, breath analysis is a very, very important thing. And, up until we came along, it wasn't really something that the average practitioner could easily do. And the reason why they couldn't was because the hardware was very difficult and impractical and expensive.
Hmm.
But then I would say the most important limiting factor was the fact that they couldn't really analyze the information and then very effectively and seamlessly and without hiring a bunch of different specialties interpret that data into actionable plans um, for their patients and customers. And so what we did as a company, first step was to make the hardware a lot easier and practical and cheaper. But then the next step, which has allowed us to really bring breath analysis to a plethora of industries that otherwise wouldn't have been able to adopt it, is to create this comprehensive software suite and services where we do all of the analysis, we generate highly customized and adaptable reports that translate all of that information into something that consumers understand. So we do the analysis for our affiliates.
Okay.
And then in addition to that, we have the ability to integrate all of their services into our software. So when we provide recommendations and biooptimization plans or nutrition programs and training programs, we make sure that that is in congruence with whatever the affiliate has in store.
So you really have to have a very close relationship with the provider
Yeah.
because you're working really hand in hand. This isn't like you're selling a product and now they're doing all the assessments themselves.
100%. And, frankly, that is a need not just for a breath analysis device, that is a need for any sort of advanced diagnostic tool or modality. You need to provide the whole spectrum of services and go A to Z because nowadays, let's face it, providers are so busy. Providers have so many different things to do.
They need that
Hiring,
support network.
hiring is extremely difficult, and retention is difficult, and then training is difficult. So you really need to be able to provide that full spectrum of support and services if you want the value of the underlying biomarkers to ultimately make it to the end consumer.
So you basically function as a first step for a lot of practitioners and wellness professionals so that this can determine how to take a customized, personalized
Mhm.
approach
Mhm.
to care and support.
That is a great point, and that's exactly what is happening now with all the different accounts that we have. For instance, like Restore or Remedy or Equinox, and or even accounts like Vituity in the primary care space. So what we're seeing is that because breath analysis is instant, it is very effective, it is uh, very global in its assessment, in the sense that it can capture reliably and very sensitively information about your heart, your lungs, your cells, your nervous system. Doesn't require any blood draw. You don't need to deliver a specimen to the lab, right? None of that is required. You just put a mask on, have them breathe normally for 8 minutes for the resting test, and put them on a treadmill or a stationary bicycle for the exercise test. If you want to do that too, it's optional, but it's something that more and more people are doing. So the whole process is very easy and streamlined, and the information that you get from that very easy process is a lot and very prescriptive in nature. So it can guide you as to how you should eat, how you should train, and then what modalities from the clinic you should adopt in your lifestyle in order to fix a specific problem that you have in your body. Um, and For that reason, it is very widely adopted as the first step in the consumer experience within within the practice.
So we have, I'm sure, plenty of wellness warriors and practitioners who are going to be watching.
Hmm.
And how does so I'm assuming that the interpretation of the results is coming from PNOE, and
Correct. Yeah.
then you work with them to assess this is the battle plan, this is the personalized
Exactly, exactly.
approach.
Yeah, there's a dedicated success manager for every account that is
Wow.
working very closely with the affiliate to sort of bring all of their logic, all of the rationale, all of their prescription methodology into our software. We built the software to be very interoperable with all these and very customizable, right? In order to be able to cater to every business specific needs.
I saw one video from menshealth.com where
Mm,
there was a marathon runner who was going through the process, and they did a great article on it, and it
yeah,
really captured a lot of
yeah,
the process and
yeah.
what this would look like. How long do you wait after the test is given before you get the results, and then you can start implementing a plan?
Oh, it can be, as little as a few hours, right?
Okay.
So yeah, we try to be very fast with all the analysis and the prescription that we do. But yeah, for most people, for most of our affiliates, what they like to do is they want to get the results a day or so later, so that they have the excuse to bring back the customer,
Okay.
because for many of them, it's an opportunity to do another upsell or something.
Well, and also that they need that time to really
Yeah, yeah, yeah,
plan a
yeah.
solid approach.
100%,
So for
100%.
those who are not practitioners, but
Mhm.
they're excited to hear something like this exists, how can they find a professional that
100%.
is offering this service?
So, very soon we're launching a dedicated locator where you can basically browse through all of our network of trusted affiliates and not only book View to Max and resting metabolic rate tests, but also schedule appointments for other services that these affiliates may be offering. So that locator is coming up very soon. Before then, you can visit the website pnoy.com, reach out to us, or follow us on Instagram. We are there as PNOE, PNOE Analytics. Message us, DM us, follow us, and someone from the team will be able to help you out and guide you to the nearest facility. Uh, for folks who are probably wondering, PNOE,
I was about to
yeah,
ask,
yeah, I had to
is
say,
there
right?
some people
Yeah,
are going to be like, is
yeah.
that an acronym
No,
for
it's
something?
not an acronym. PNOE stands for breath in Greek.
Come
Both
on.
my co-founder and I, born and raised in Greece, we're very Greek as it gets, as I like to say. And there's a lot of Greekness in the DNA of the company, so it had to be called PNOE,
I love it.
which stands for breath and soul in Greek.
So I normally ask this question
Mhm.
first, but I'm actually going to ask this last.
Yeah.
How did you come into this industry, and how did you create PNOE?
Yeah, I sort of alluded to that earlier. So the idea started from my co-founder. He was doing his PhD in sensing technologies. He run into breath analysis. Breath analysis is a very interesting and emerging field in the world of medicine. Uh, First of all, because we have modalities like cardiometabolic testing that has been around for about 100 years
Right?
and it's like massively underutilized,
Yes.
right? It's so important and still like most people don't know it and even fewer have actually done it. But in addition to cardiometabolic testing that is looking into oxygen and CO2, there's like a wide range of gases and elements that you can track from the breath that can be predictive or of diagnostic value for multiple different conditions. And so breath analysis is going to be a huge thing moving forward.
Yes.
And so that's how we started. And, ultimately our intention is to branch out to these other fields. So it started from that, right? And
Yep.
we, as I said, we started by building the device, making it smaller, portable, more practical, and then over time build a whole stack that the affiliates would need in order to make that successful for their practice.
While we're here at the forefront, the frontier of biohacking, this wellness
Hmm.
revolution that's happening, where do you see this company going in the biohacking movement and in this movement of wellness. People are becoming more aware that they can get in the driver's seat of
Hmm.
their health journey
Hmm.
again, and that somebody else doesn't have to steer it for them.
Yeah.
Where do you see this going in the next 5 years?
I mean, definitely biohacking, longevity, all of that movement is gaining a tremendous amount of steam. And we see that market as a launch pad, right? To basically brunch into the general population and make that assessment something that everybody should do at least on a yearly basis, right? And again, that's not something that we are passionate about just because, like, the American Heart Association in its official statement back in 2016, uh, pretty much openly stated that breath analysis and VO2max testing is something that ideally should be done by every individual on an annual basis at least. The question becomes, like, how can you actually get to that point, given the fact that our traditional healthcare system is so antiquated,
Hmm.
it's so archaic, it's so
Yep.
difficult to bring anything preventative and anything innovative for a variety of reasons. I'm sure this is like a topic for a different discussion. But I think the whole biohacking and longevity space is a great launch pad, not just for breath analysis and PNOE, but for anything that is innovative and has true fundamental value to reach a critical mass, right?
Yes.
Establish like a foothold, like a beachfront, right?
Yep.
And then from then on, uh, be able to sustain itself while it's branching out into the wider population.
The future is bright for this.
100%. And,
Yeah.
it's very, very, refreshing and exciting to see that, for companies like us, biohacking and longevity has a critical mass, right? That is big enough to sustain a sizable company and then use that launch pads as, as a platform to go further.
Absolutely.
Yeah.
One more time for those who are watching the website.
PNOE, PNOE.com. And then Instagram would be PNOE Analytics.
Awesome.
Thanks,
Panos,
Nate.
thank you so much
I
for joining the
appreciate it.
Pulsecast.
Yeah,
We
yeah,
appreciate everything that you're contributing to this
yeah,
space. You're needed. We
yeah.
need more companies like you who
Thank
are
you so much for your kind
putting the people
words.
back,
Yeah,
absolutely, back in the driver's seat to
yeah,
own the health journey.
yeah.
And we're here at the frontier of biohacking and the wellness movement. So stay connected, stay tuned. This is your tribe. We'll see you next time.